A patient's peak flow rate is measured using which of the following devices? Now, the peak flow rate has to do with the respiratory system, and specifically when we measure peak flow, we're seeing how much a patient can forcefully exhale. So we want to see, out of all these choices, which one we could recognize as being part of the respiratory system and measuring this peak flow rate within the respiratory system. So a good test-taking tip, let's see if there are any choices that we can recognize that we can eliminate right away. So option C over here, the otoscope, that's used for ears. That's what the device that the provider will look at the patient's ear with, and therefore we can eliminate option C because we're looking at the peak flow rate, which is related to respiration and not ears. And then you might also recognize the sphigometer, which is a fancy word for the blood pressure cuff, so we could eliminate option D as well. So now, if you're between the tonometer and the spirometer, which one do you choose? So you might use additional knowledge that you have from something similar to recognize which one to use. So if you look at the term spirometer, have you heard of an incentive spirometer? You know, the device that is like this, where there's the little handles, and then there's the arrow with the lines and the little ball. Usually you'll see it in post-op. And then the patient will be given a goal to exhale to get this ball to go up, up, and up. And it shows how much they can exhale in one breath. And similarly, the spirometer in the test for peak flow works the same way as the incentive spirometer, and therefore that is your answer to this question, as opposed to the tonometer, which actually is a device used to measure glaucoma, and therefore that's not what we're looking for. So option A is your answer here.